the kind of shift in mindset, I guess, is the easiest way to say about
Yeah.
people are just not in alignment with that now, and they didn't understand that a fat transfer was even a practical or possible alternative. Because if you, from a surgical perspective, I did hundreds of them every year for breast cancer patients,
Right.
and that is not a common path. So you wouldn't have that level of experience or repetition. And surgery, for everybody listening, is you get better at surgery with time, and your first 10 or 15 years after you finish, you're constantly improving and getting better because you're doing and repeating a set of skills and steps, and you
Yeah.
get better at it. It's one of the few things where that happens.
Yeah.
And so, like, when people say fat transfers don't work, I'm like, really? Okay,
Yeah.
interesting.
Yeah.
Those are usually the folks who say that they tried hormonal therapy and it didn't work. And I'm just like, man. So if we take someone like Alexi, and she has she's a low BMI patient, but we take enough fat and we transfer it, whether it's, we'll say it's 100 to 200 cc's per side. That's roughly close to a cup size if it's 200, and then half if it's and for her body type, maybe that's all she wants, and then that's great.
Yeah.
And then people ask me, well, is that a one and done? Well, that's the patient's prerogative, not mine. Like,
Right. Right.
make
Right.
that decision. That's a visual thing that the patient wants. And then they used to have this discussion, Lexi, with patients who came from cosmetic breast augmentation. And if they asked me for a big implant, I would just simply tell them no, because I didn't
Wow.
really, it didn't align with me personally, because I thought it looked bad. So I was
Yeah.
do it.
Yeah.
And
Yeah.
if they wanted a super small implant, I'd say, well, a fat transfer is better than that from a longevity standpoint, meaning that your exposure risk over time is going to be more risky if you have an implant that's small versus a fat transfer, because it's your own tissue. And so, like, there's this juxtaposition that people either, a full explanation is what everybody wants to get
Right.
an informed decision, to make an informed decision. That's basically it. And I hear that they don't, or never even knew those